suffer from back pain, neck pain, migraine, vertigo? Do you find it hard to believe that a cardiovascular problem such as hypertension or irregular heartbeat, a digestive and respiratory disturbance, and several other disorders could be linked to a misalignment of the spine? Watch this video to learn more. The Atlas orthogonal technique, painless and non-invasive, has proven very effective for these disorders. For over half a century, this technique, developed and taught in the United States by Roy W. Sweat, professor at Life Chiropractic University in Atlanta, Georgia, has been successfully used in North America for the treatment of back pain, sciatica, headache, neck pain, and vertigo or dizziness. The history of treating the cervical spine dates back to the early 1900s, when Dr. B.J. Palmer, following in the footsteps of his father, the Canadian founder of chiropractic, D.D. Palmer, spent many years of clinical research in discovering that it was the atlas that controlled the position of the head and the resulting position of the rest of the spine. Professor Roy W. Sweat, in his further research, invented and engineered a highly advanced instrument that we are going to see in use during the second part of this video. The Atlas orthogonal chiropractic procedure was born, and over the years, thanks to the teachings of Professor Roy W. Sweat, has spread worldwide. Chiropractic is the third largest healthcare profession in North America, after general medicine and dentistry. In Italy, chiropractic has been recognized by legislators as a primary health profession since 2008. The evidence in favor of chiropractic, and recently the Atlas orthogonal technique, has inspired a proliferation of abusive, unqualified chiropractors, as well as unaccredited graduate programs. A list of accredited institutions is available on the websites of the professional associations and accrediting agencies. To prevent the abuse of the profession, chiropractic was licensed and regulated. It can only be practiced by doctors with a degree in chiropractic from accredited universities, enabling them to diagnose disease and health conditions and to treat patients. Dr.SABA Saya graduated from Sherman University in the U.S. and has been licensed both in Canada and the United States. She is a member of the Italian Chiropractors Association and of the World Chiropractic Alliance. A considerable part of the population suffers from back pain, sciatica, headaches, neck pain, and vertigo or dizziness. Many of these disorders may be due to the abnormal curvature of the spine. When the skull, the top cervical vertebra, and the rest of the cervical spine are not aligned, the whole spine shifts, trying to compensate and maintain balance. Many years of scientific research have led to the conclusion that the abnormal curvature of the spine and its consequences can be associated with the misalignment of the atlas, first cervical vertebra, skull, and cervical spine. Causes of the displacement of atlas, skull, and cervical spine may be tears, strains, stress, traumas, including childbirth, contusions, road accidents, even without immediate symptoms, falls, and improper behavior causing microtraumas in sitting, carrying bags, lifting weights, or even during sleep. The nervous system consists of the brain, spinal cord, and spinal nerves. The central nervous system, brain, and spinal cord transmits information, controlling and regulating all voluntary bodily functions, as well as involuntary functions such as cardiovascular, like heartbeat and blood pressure, respiratory, digestive, urinary, reproductive function. Messages go back and forth from the brain to all parts of the body. There are spaces between vertebrae, allowing nerves, which are extensions of the spinal cord, to supply and connect every part of the human body. The spine is like a chain. Consider the atlas the first and most important link in that chain. When the first link is twisted and turned, each link all the way down to the last link turns, thereby disrupting the rest of the chain. This puts pressure on the nerves and may cause migraine, neck pain, vertigo or dizziness, back pain, sciatica, and a considerable number of other health problems. A misaligned spinal column interferes with the transmission of the messages between the brain and the rest of the body. As a consequence, the nervous system is unable to function as it should, thereby leading to a variety of symptoms and diseases affecting various parts of the body. The Atlas orthogonal chiropractic technique points to the realignment of the first cervical vertebra in relation to the skull and the cervical spine, so that the rest of the spine comes into a better alignment, thus relieving nerve pressure and pain. An extensive evaluation of the patient's condition is conducted by Dr.SABA on the first visit. A complete and thorough medical history is critical in aiding the doctor in the proper diagnosis. It's followed by palpation of the cervical area and of the whole back, looking for muscle contractions or inflammation caused by pressure on the nerves by the misaligned vertebrae. A leg check is performed to determine which leg is shorter. This shortening happens because when the atlas is moved out of its orthogonal position, the body tries to compensate to maintain balance. In doing this, the rest of the spine adapts and is thrown out of alignment, and the muscles contract to cause one leg to appear shorter due to the inclination and rotation of the pelvis. To see is to know, not to see is to guess. Following this warning, when the initial exam determines that the Atlas orthogonal treatment is appropriate for the patient's condition, the patient will undergo diagnostic imaging to reveal the exact degree of misalignment of the Atlas vertebra. This allows the doctor to assess, by using specific mathematical calculations, the precise Atlas position and the angle at which to apply the instrument for the correction, which, it is worth being reminded, is absolutely painless. Dr.SABA uses state-of-the-art technology to return the atlas, cervical spine, and skull to their orthogonal positions, thus eliminating interferences with the nervous system. The movement of the atlas has been verified on live motion video fluoroscopy studies, as can clearly be seen here. The energy generated by the instrument is transferred to the stylus, placed on a precise spot on the side of the neck below the ear. This makes the atlas move, instantly decreasing nerve compression. It uses the same principle of physics as the Newton's cradle. When one sphere on the end is lifted and released, it strikes the stationary spheres. A force is transmitted through the stationary spheres and pushes the last one upward. The patient's neck will be re-examined after the adjustment, and a leg check will be performed again, as well as the palpation of the neck and spine and a postural assessment to look for any improvement. This does not mean that the symptoms will always go away immediately. Occasionally, the results happen to be immediate and dramatic, but it must be said that the longer the existing condition is gone without treatment, the more time and treatment it may take to improve. Symptoms can get worse, and the problem becomes more difficult to correct.